A warm welcome to all of you here, either in Geneva or connected online. And this is the World Health Assembly side event on ear and hearing care towards a new resolution on ear and hearing care for the next governing period, 2025. My name is Diego Santana. I am the Senior Advisor for Ear and Hearing Care for CBM, which is a global development agency working in community-based inclusive development, reaching all those in greater needs across the world. Our role as CBM here today is only to facilitate a platform, a table, to invite the wonderful speakers that we have here today. But before we do that, I want to give you some remarks regarding housekeeping, particularly for those joining online. And for that, I'm going to show you a few tips. You will see that this meeting is being recorded, and you already accept them being recorded by joining this meeting. We will have at the end question and answer sessions, and you can write and send your question by clicking on the Q&A button at the bottom. There is also closed captions provided in English that can be enabled via the CC and closed caption button at the bottom. And also we offer exact English Sign Language interpretation, as well as Danish Sign Language, which again can be enabled in the interpretation button at the bottom there. You will see for those joining for looking for Danish Sign Language, is actually under German Sign Language because there was not a title for it. And we ask you to be respectful in your interventions, considering all the broad range of the participants we have today. So without further ado, I want to give you an introduction on what are we expecting here today. And it's basically three things. First, I want, on behalf of the co-host, we want to thank particularly our colleagues from the International Federation of Otolaryngology Societies for sponsoring this event, alongside with the collaboration of the International Society of Audiology, but of course also our colleagues at the WHO at headquarters, and also member states who are joining, particularly the Slovak Republic and the Republic of the Philippines, who are here present today, for which we're eternally thankful. We want to make sure that we have a broad input across the stakeholders who influence and positive change the world in ear and hearing care. And on the second section of this side event, we have a very broad panel with different actors who will be able to provide their insights on what is the state of ear and hearing care and what is the way forward and the next steps that we would like to have. To start with the program, I want to invite Dr. Hussein Abdul Rahman Al Rand, who is the president of the Emirates Otorhinolaryngological Head and Neck Surgery Society, and also the current president of the International Federation of Otorhinolaryngology Societies. Dr.
I would like to welcome all of you, Professor Milan, colleagues who is present here with us, as well as who are online, couldn't join us today. The important thing about our topic, which is today's topic, is what? Is the hearing care. Hearing is a gift from the God for each of us. So we should always take care of our hearing. So thanks for the Slovak Republic to take the new initiative about the resolution about the hearing. And I would like to encourage my colleague also to speak to their country to support this resolution, because this resolution is an initiative started by Slovak Republic toward a new WHA resolution in governing period 2024-2025. And I would like to encourage the mission here to write to other mission, so to be sent to Ministry of Health all around the world. So when it comes to Ministry of Health, I mean, colleague who is with us from online, they can speak to their Ministry of Health. Please support this initiative and support this resolution, because it will help the people to hear. Because without hearing, you are away from the life, away from your surrounding. Thank you very much, and thanks for Milan, and also for IFOS to support this initiative. Thank you. I will not take your time. I know the schedule is busy, but thank you very much.
Now,
WHA will support.
Thank you so much. That's a pledge from the United Arab Emirates. So thank you so much. Well received. Our next speaker is Professor Milan Profant, who is the head of the University Department of ENT Head and Neck in Bratislava in the Slovak Republic, and past General Secretary of IFOS as well, who will be speaking on behalf of the Slovak Republic. Here's the floor. Prof. Milan.
Thank you, Diego. Ladies and gentlemen, it's really an honor for me to present the position of the Slovak Republic regarding the call for the resolution on ear and hearing care. Maybe what I would like to talk about is why Slovak Republic and what are the WHO materials regarding the ear and hearing care, what is the situation internationally today, and what is the availability of the ear and hearing care in the world. So the question is, why the Slovak Republic? Because really in Slovakia, we do not have a significant problem with ear and hearing care. It's on a very high level. There is 14,000 inhabitants for one ENT doctor. That means that this is 71 ENTs for 1 million. And you will see the international statistics, which is completely different, especially in low-income countries. Children receive significant contributions for bilateral hearing aids. Bilateral cochlear implantation is fully covered by health insurance, both for children and adults. Neonatal hearing screening is compulsory from 2006. Adults receive contributions for hearing aid. Implantable hearing devices are fully covered by the health insurance for children and adults. So why we should propose something to improve the ear and hearing care? But Slovakia is not the island in the world. We know the situation all around, and it's quite active in international cooperation to support and training in the ear and hearing care, and support for the WHO ear and hearing care through the NCD. And this is mostly done by the International Federation of Otolaryngological Societies, IFOS, which I've been General Secretary for past 2 terms. We provide training to otologists and audiologists in sub-Saharan Africa already for 7 years, annually the education and training course. There are other courses in the lower developed areas of the world, like in Vietnam, in Costa Rica, in Peru. We went to Dubai some years back, Harare, as I said, Indonesia. Slovakia, personally, I regularly visit many low and middle income countries to support their ear and hearing cares, especially East European countries, Caucasian region, Central Asia countries, Sub-Saharan countries. That all means 3 continents, 19 countries, 27 cities when I have contacts to the audiological and ENT departments. So I personally, and we in IFOS, fully understand why the resolution on ear and hearing care is inevitably necessary, and that is also why the Slovak Republic. So that means that Slovakia is well aware of the shortages in ear and hearing care internationally. Ear care is difficult to access in the low and middle income countries. Accessibility to hearing assistive devices is very limited. Majority of these expensive devices must be partially or fully covered by the recipients. Educational and training of experts inside the region is limited. And trained experts very frequently look for more attractive jobs opportunities, But this is something also in high-income countries. This means that East moves to West and South moves to North. I would like to talk a few words also. What is the history of the official document of WHO on ear and hearing care? So you can see that there are not too many. In 1985, there was a prevention of deafness and hearing impairment resolution. Under the same name was the resolution in 1995. And then there was maybe 18 years break. And in 2017, with new activities in non-communication diseases department, there was a resolution on prevention of deafness and hearing loss. And a great achievement was the World Report on Hearing, which showed us real disaster numbers in the hearing loss, how the hearing loss is on the rise. So definitely hearing loss is on the rise, and we have to do something with that. These are the numbers. The red line is the all hearing loss. The black line is those who really need a help to improve their hearing with the actions. 1 billion young people are at risk of permanent hearing loss due to recreational listening at loud volumes. And there is also activity of WHO, of the Department of Non-Communicable Diseases, on the listening devices. 200 million people can suffer from the hearing loss, which can be prevented. Nearly 80% of those with hearing loss live in low and middle income countries where services for ear and hearing care are commonly lacking. So more hearing loss we have in the areas where we have low access to the actions. Here are the numbers about the availability of the ENT specialists and audiologists. I told you about the Slovakia, which is this in here. This is the more than 50 ENT for 1 million. This is the Slovakia, I said it was about 70, but here you can see the low-income country, they have somewhere 14 countries where is 1 ENT doctor for 1 million citizens. And this is something we have to address with this resolution. Most people with hearing loss do not have access to the intervention. As I said, this distribution between South and North is that in South, you have too many hearing losses and you have too few experts to help. Cost of unaddressed hearing loss is very high. And that's what probably the governments do not accept in the way we can see it, but not addressing the hearing loss means higher cost than investment to take care about the hearing loss. So why the resolution on ear and hearing care? The hearing loss is on the rise, we see it. Low accessibility to otologists and audiologists in low and middle income countries. Stimulation of local governments to take actions to support ear and hearing care. I personally, when I travel in these countries, I hear from my colleagues, if you tell them they listen to us. If we go to them, they do not listen to us. That's why you have to address them. Increase the accessibility of hearing assistive devices in low and middle income countries. Stimulate international experts to provide affordable education and training in otology and audiology specialists from low and income countries, but directly inside the area. So please support the call for the development of the new resolution on ear and hearing care for the 78th WHA in 2025. Thank you very much for your kind attention.
Thank you very much. Thank you very much, Professor Profan. Following with the program, there's a slight order change. So we'll hear from Dr. Alakos later on. But now we're going to hear from Dr. Shelley Chathan, who is the head of the Ear and Hearing Care Department at WHO headquarters. Shelley, it's a pleasure.
Thank you, Diego. Thank you for the kind introduction and for this organizing this event. So thank you to all. 7 years. that's how long it has been since the last resolution on ear and hearing care was adopted on 30th of May, actually. So just coming up on the anniversary of that in 2 days, 2017. And what action-packed 7 years it has been. Because this resolution gave a call for action to member states and also provided direction to WHO. Working on the mandate of this resolution, WHO in 2021 launched the World Report on Hearing, which Professor Provant mentioned. The World Report on Hearing, which provided clear evidence of the rationale of a public health action for hearing loss, to address hearing loss. It showed how hearing loss is continuously rising, and from nearly 500 million people currently, it's expected to touch over 700 million people by the year 2050, 700 million people who need ear and hearing care. It also showed that ear diseases are some of the most common conditions that are encountered in the community, conditions which can often be prevented and can be treated. It also showed that currently, less than 20% of those who could benefit from interventions to address their hearing loss are actually receiving the benefit that they need. But this report was not all gloom and doom. It also showed us that it's possible. It's possible to have good hearing through strong public health action. Public health action that targets prevention, that looks at early identification of hearing loss, and providing care and rehabilitation to those living with hearing loss. It also provided strategic direction based on strong evidence, direction that focuses on the integration of people-centered ear and hearing care into national plans for universal health coverage that can ensure hearing care for all. In these action-packed 7 years, WHO has created a suite of tools, technical resources that can help countries to integrate ear and hearing care within the national health systems. So tools to plan for ear and hearing care, what kind of indicators to include, how to train people at the grassroots level, at the primary care level, how to screen, how to establish screening programs for newborns or adults, what kind of assistive devices to provide and how to provide them. Also, tools to raise awareness. And as pointed out by Professor Profant and hidden by the wonderful captions here, also launched a strong initiative to reduce the rising prevalence of avoidable hearing loss caused due to exposure to recreational sounds, due to listening to music at high volumes. We have also, over these past years, worked with a number of countries to provide technical support in establishing training programs or undertaking situation analysis or doing whatever it was that the country needed to do to upscale ear and hearing care. But the key lesson that we have learned over these past 7 years is that it's not enough. Business as usual is not enough. It's not enough to talk only about providing ear and hearing care as a vertical program targeting tertiary level centers. It's important to think of it as an integrated approach, integration of hearing care across the course of life in various programs for morbidity reduction, such as for newborns, for children, for adolescents, for in schools, for older people, as well as integration across the continuum of care, from the primary care level right up to the specialized services. There needs to be integration. And such integration can help us not simply to address the need, but actually to reduce the need of specialized services by almost 60%. 60% of those with ear and hearing care issues can be addressed. 60% of those problems can be addressed at the primary and secondary levels of care. However, this integration requires us to have a different approach. We need to have integration both at the policy level, also at the level of capacity building at the primary level. So we need to build capacity of people, not just at the tertiary and secondary level, but also at the primary level, to be able to identify ear and hearing problems and to be able to address them, to be able to prevent them. And to do this, we also need to look beyond the way of our traditional way of working and explore innovative service delivery models and approaches which can make care accessible for people where they live, when they need this care, and without posing financial hardship to them, in line with the mandate or with the vision of universal health coverage. So the key message from my talk today and for the new resolution is that we need to focus on integration of ear and hearing care across the course of life and across the continuum of care. Thank you.
Thank you very much, Dr. Chatter. And following Shelley Chatter, then we now have Dr. Alarco Ciesa, who is head of the Integrated Service Delivery Unit and the Sensory Functions Disability and Rehabilitation Unit at WHO Department of Non-Communicable Diseases. Martha.
Thank you, Diego, and thank you again to our co-hosts or the co-sponsors, Slovakia, the Republic of Slovakia and the Republic of Philippines, but also to our co-sponsors. And for those online, and many of our partners are online, they know that we really always try at WHO when we welcome our partners to have original meetings. I also want to communicate today also to our online listeners that we are in a very original venue. And I also want to thank the co-host and co-organizer for that. So it's really original, and I'm sure that all of us who are here present today will not forget it. And Shelley really make the case for integration along the continuum of care, integration at all levels of care, from primary, secondary, tertiary to tertiary care level. I want, however, also to make the case for integration in other disease areas. And that is also absolutely fundamental for ensuring that there is not universal health coverage without ear and hearing care. And really to achieve this goal of ear and hearing care being integral part of universal health coverage. So I want to make the case for the integration of ear and hearing care into the non-communicable diseases agenda, because they also belong there, and all the diseases behind hearing loss, behind hearing impairment, are non-communicable diseases, and the agenda of ear and hearing care can also take advantage of the momentum of the NCD agenda. And we have next year in 2025, the 4th high-level meeting on NCDs at the UN. And look, also to make the case in a different way and to activate the stakeholders from the area of ear and hearing care, the agendas of vision and oral health that are also non-communicable diseases are already recognized in really in the narrative of this high-level meeting on NCDs, but not yet ear and hearing care. And one could really ask why that is the case. when actually we can build such a great argument for it, because the agenda of non-communicable diseases is really concentrating into preventing premature mortality, ensuring that people can live as long as possible. But the agenda of ear and hearing care is exactly the same like the agenda on vision and the agenda on oral health, is to ensure that people live well. Because all of us can empathize and really know what does it mean and what is really the loss and quality of life and well-being when, in this case, one can lose their hearing. Even if we have solutions for all. So it's really making the case also for that integration into the NCD agenda, also integration among other areas of health. As I have said, those agendas that have so much in common with the ear and hearing care agenda, like vision care and oral health, but also integration into really maternity and child health, adolescent health, and the agenda of older people. And again, with the objective of embracing that there is no universal health coverage without ear and hearing care. Thank you.
Thank you very much, Dr. Alarcos. And we're already hearing wonderful sentence, and we can take away. It's not enough. There is no universal health coverage without ear and hearing care, and more to come. And next is my honor to invite the Honorable Director Yerna Manatar, who is Director 4 of Disease Prevention and Control Bureau of the Philippines Department of Health. The floor is yours, Doctor.
Thank you and good afternoon, everyone. It's an honor for us to be part of this engagement and for the opportunity of the country to also present what are we doing and then how far are we in terms of taking good care of our citizens, particularly on our eye and in our ears. Ladies and gentlemen, ensuring the well-being of our senses is paramount in achieving universal health care. Today, we gather to acknowledge strides made in eye and ear care in the Philippines and chart our course for the future. In eye care, the 2023 Eye Care Situation Analysis tool highlights our progress and challenges. The Prevention of Blindness program focuses on enhancing access in rural areas through comprehensive primary care. Eye care is integral to achieving universal health coverage, supported by Philippine Health Insurance, which covers cataract surgeries. Despite advances, urban-rural discrepancies persist in our country. We must integrate eye care into broader health initiatives, expand financial coverage, upgrade primary care infrastructure, and bolster awareness campaigns. Collaboration with international organizations and NGOs for capacity building and training is very crucial. In hearing care, legislative measures and specialized services marked positive steps forward. Republic Act number 1979-09 established a universal newborn hearing screening program in the country, and National Health Insurance covers diagnostics, hearing aids, and speech therapy for children. The deaf and hard of hearing are recognized as persons with disabilities under Republic Act 7277, entitling them to various benefits. Republic Act 1106 mandates the use of Filipino Sign Language in government transactions and other settings. Regional specialty care centers for ENT provide advanced services through a national referral network. Yet, gaps in financing coverage for adults and preventive measures remain. The Philippines and the Department of Health stands poised to lead these endeavors, strengthening community-based integral care, expanding healthcare financing, prioritizing infrastructure improvement, and intensifying public health campaigns are essential. Enhancing training for professionals, fostering international partnerships, and utilizing telemedicine will ensure specialized services are accessible to all. Furthermore, in our pursuit of equitable eye and ear care, we call upon the international community and the World Health Organization to continue their pivotal role in steering necessary reforms, particularly addressing the glaring disparities between urban and rural settings and with low and middle income countries demands concerted global action. By pooling resources, sharing best practices, and fostering collaboration, we can strive forward towards a world where access to essential healthcare knows no boundaries. Let us unite in this noble cause, ensuring that no one is left behind on the path to improve eye and her health. Thank you very much.
Thank you very much, Director Gerna Manatad. We've heard from WHO, we heard from WHO member states, and before we go into the panel with a broad array of other international and local stakeholders, there is a bridge. There are important organizations that actually bridge the governmental and non-governmental sectors. And a great example is actually, we have the honor to invite today Dr. Satish Mishra, who is the head of global programs and markets at AT-Scale, the global partnership for assistive technology, who's going to tell us how does that work, that bridging. Thank you.
Thank you very much, Diego. I probably started a bit early, thinking that the bridge needs to be established a bit earlier on. But thank you very much for the invitation and the opportunity to speak at this important side event, gearing towards a new WHA resolution. And it's a pleasure speaking about it because I've been working in the space of health system strengthening with focus on strengthening health services, including ear and hearing care. And it's an area which is very close to the organization which I'm working and very close to my previous experiences. The organization which I represent, AT-Scale, is a cross-sectoral global partnership with a mission to transform people's life through assistive technology. AT-Scale catalyzes action to ensure that by 2030, more than 500 million people have access to assistive technology. The activities of AT-Scale includes market shaping, global public goods, and country engagement. And currently, AT-Scale is working in nearly 30 countries in scaling up access to vision and hearing services, as well as access to assistive products. Examples of assistive products are physical products like hearing aids, hearing loops, or digital products like captioning, as we see it on the screen. Assistive technology enables people to live healthier, productive, independent, and more dignified life, to participate in education, to go to work, participate in society. Assistive technology is a highly cost-effective intervention and is crucial for achieving all the 17 Sustainable Development Goals. Addressing hearing loss has a profound positive effect on individuals, families, and societies. And something which was alluded earlier on the WHO, World Health Organization World Report on Hearing in 2021, we show cause and demonstrated that every dollar we invest is a return of $16 if we do 4 interventions. And one of them is assisted technology. Access to ear and hearing care is both the right way forward as well as a smart way forward. The World Report on Hearing, which also Professor Milad also alluded on the gaps and inequities across low and middle income countries. Globally, we see 17% of the people have access to hearing aids they need. In low income countries, it's only 9%. This is staggering. In low income countries, 1 out of 10 person who could benefit from hearing aids have access to one. But what about the remaining 9? Addressing such inequities in access to assisted technology is what drives AT-Scale. AT-Scale is hosted by United Nations, Office of Project Services, as a cross-sector for global partnership and a proud member of the UN family. AT-Scale is a living example of international agencies coming together and supporting issues like ear and hearing care strengthening. The World Report on Hearing recommends that people-centered approach integrated with strong and resilient national health system, which is something also Shelley and Elakos earlier emphasized and made a case towards it. But in order to strengthen the health system, enablers must be developed for quality, affordable ear and hearing care to become a reality for all, and for it to be available at all levels of care, including primary care, where most people can benefit from. Current challenges in low and middle income countries include lack of national ear and hearing care strategies, insufficient planning, lack of budget, lack of human resources, lack of skill trainings or transfer of task sharing. Capacity related with task sharing is also limited in many low middle income countries. And there was a very strong case which was made about integrated approach. And I hope it reflects strongly in the forthcoming discussion around the new resolution. But I also want to make a case for diagonal approach. There are instances where at country level, we do need to establish some specialized services, which can probably address some hearing condition or can work as a role model for policymakers, for stakeholders to understand the importance of the agenda and access to those services. And this is as a part of sporadic vertical programs with an aim for integration, but we do need those demonstration sites to sometimes serve an example for others. And we also need, as strongly emphasized, an horizontal programming with system strengthening so that ear and hearing care can be strengthened and integrated across all levels of care. Developing strong and resilient health system and services can only be a team effort. And at country level, this requires policy, advocacy, planning, financing, quality, collaboration with various stakeholders, including with private stakeholders. And there's the only way forward through teamwork and through unity. This side event is a great example of the concentrated effort that international agencies can make towards equity in ear and hearing care. Globally, international agencies can set up the agenda for ear and hearing care, support countries in implementing effective programs, and advocate for ear and hearing care locally as well as globally. AT-Scale is committed to working with all relevant stakeholders towards improving access to life-changing assistive technology. AT-Scale work towards a world where a person with hearing loss can access and afford assistive technology they need, enabling a lifetime of potential. Together, let's break the silence and work towards inclusion. Thank you very much.
Thank you very much. Thank you very much, Dr. Mishra. Another one for your quote. diagonal approach. We always heard about the traditional vertical approach and the need for strengthening health systems and services through horizontal approaches. Diagonal approach, and one more to help us on our advocacy quest for including ear and hearing care. Thank you to all these initial panelists and speakers who've set the tone of what the background is at the global level, WHO level, a member states level, at international cooperation level. Now we are going to pass on to the next section, which is the panel, for which we have invited 6 organizations with chosen speakers. And due to the brevity of the short timing for this meeting, we have one in person who I'm going to start inviting by the ones who are already here, who is Dr. Jacqueline Drexler, who is a doctor in audiology and member of the World Hearing Forum Changemakers World Stream, who's coming all the way down from Zurich in Switzerland. So if you want to come across and take a seat here. Thank you so much. An applause. And I'm going to invite, and they're going to appear, just have a, no. And I'm going to invite our panelists who have joined online. And I'm going to start with Kasper Bergman, who is the Vice President of the World Federation of the Deaf. He's from Denmark. I wonder if we can show in the screen so that our participants here in Geneva can also see them in the screen. That would be great. Okay, yeah. Hello, Kasper. So Kasper is joining us all the way from South America in Guatemala this time. If I could just briefly say hello, and then I'll come back to you. Okay, that's fine. That's super. And we'll hear from the sign language interpreters in a minute. Our next panelist is Carol Willems, who is the president of IFO, the International Federation of Hard of Hearing People. So if we can pin up in the screen all the people who are having for this panel discussion and presentations, that'll be great. There you go. That's super. Excellent. That's fine. I will hear from you in a minute. Our next panelist is Dr. Rachel Hapunda Chibanga, who is ENT surgeon from Zambia, national coordinator for ear and hearing care at the Ministry of Health, and president of CENTAS, which is the Zambian ENT Audiology and Speech Therapy Society. Again, if you could wave, Rachel, so people can identify you. Thank you so much. Then we also have Professor George Tabarkiladze, who is Secretary General of the International Society of Audiology. George, if you could wave so people can identify you. Thank you. And also we have Anne Porter, who is co-chair of the Global Coalition of Parents of Children who are deaf or hard of hearing. Again, Anne, if you could wave so people can see you. And excellent. And the other, you probably know Snigdha Sarkar, who is the other co-chair. And also joining us on behalf of ISA is Dr. Jackie Clark, who is doctor at the Texas University again, and here's waving. Thank you, Jackie, for joining. Super. So why such a big range of panelists? We've asked them the same question, but all of them had different perspective on how to answer that question. If we were to have a new resolution on ear and hearing care with all the support of WHO member states, what will be the key points that should not be missed on that new resolution? And that is how they have replied, and we have actually asked them to share. So remember that you can pose questions for the panelists or for any other of the previous speakers in the questions and answer chat, and then we'll address them at the end. But we're going to start with the World Federation of the Deaf, with Kasper Bergman. So if you could please go ahead, Kasper, and if we could please move the captioning away from the face of Kasper, that would be wonderful. That's super. So Kasper, the floor is yours.
Good morning, good afternoon. I'm happy to be able to participate today, though it's online. And we at the WFD, we are a non-government organization with 160 member countries represented and about 70 million deaf people worldwide, whose rights we promote. We promote the access of full and equitable lives for our members. And our main focus is the human rights of deaf people, the right to sign language primarily, in that it gives access to information and communication in the daily life. And in that, access to ear and hearing care services. Deaf people worldwide, we divide into two groups, so to say. We belong to a group of people with disabilities and a group of minorities language speakers. Sign languages are natural languages, and they must be acknowledged on an equal footing with other languages worldwide. Deaf people, we use sign language in communications and to express our culture and to express our linguistical identity. And therefore it is very important for our mental health wise and social quality of life. And the acknowledgement of sign language from governments ensures the full access to communication and the full access to society, according to the Article 21 of the UNCRPD. When you see the new resolution, the WHA report as well, resolution, and the resolution 7013, all these three are in line with the recommendations from the WFD according to the content of the new resolution, the new proposed resolution. For instance, when you see low and middle income countries, these are especially affected. First and foremost, we would recommend that the World Health Association Assembly have a broader approach to ear and hearing care and adapt sorry, just a second, human rights perspective on this. According to the UNCRPD as well. The first international sorry, a bit of help. Yeah.
Wait, we're having a shift in sign language, sorry. So interpreter. Yeah, we have to secure the rights for deaf people, not only as being an disability, but also being
Minority.
Being a minority linguistic wise. So we are proposing that the resolution is focusing on that, that people with hearing loss and deaf people are using sign language.
And we would really recommend that you take this approach. Taking this approach would relieve deaf people of the stigma related to hearing loss and improve people's lives in different ways. Another thing, according to Article 25B in the UNCRPD, member states are required to give early intervention and identification interventions to people with disabilities, including children. And they are required to prevent disabilities from occurring in the first place. And we would recommend that the WHA adapt this approach as well, and encourage early hearing identification programs be implemented in each member state, especially with a focus on low and middle income countries. The countries that have these programs should implement them from infancy and implement early hearing screening across the board, and implement the services and the interventions needed. We would recommend that you implement these options in, for instance, for sign language and language interventions in the resolution as well, including the teaching and use of sign language from birth. However, 95% of deaf children are born to hearing parents who don't know about sign language and have no idea how to learn it. And therefore it should be included to have knowledge and recommendations about sign language to these parents. When you give children sign language early on, it means they get access to a language communication and a communication system that would prevent language deprivation early and later on in life. The World Report on Hearing stressed the huge benefit these children have of early access to sign language, and as well as the access to sign language of their families. We also need deaf role models, and we at the WFD would recommend that the WHA resolution includes, as well as the NDI programs across the world, includes the use of sign language and other communication options for deaf people. As a third point, the Article 9 and 26, those two on the UN CRPD recommend health and information offerings for the member states to be provided to their publics. The resolution 7013 promoted not just hearing aids or hearing technology or rehabilitation, but also sign language on an equal footing with technologies. The ear and hearing care services should as well offer deaf people and their families these offerings should be based on sign language, because it will give a large benefit to the deaf community around the world. So these are included in our recommendations that sign language should be included in all levels and in all services, both the use and the teaching of sign language. As a fourth and last point, Article 4.3 and the World Report on Hearing both conclude and recommend, based on those conclusions, that the member state implement national healthcare policies in close communication and with the involvement of the deaf communities in the countries. The EHC, the ear and hearing care programs, are designed for deaf people and people with hearing loss, and therefore it makes sense to include them in the programs and to take care of their needs especially. And therefore we recommend that the resolution should really stress the importance of ear and hearing care and health authorities, health services be made in collaboration with deaf people and sign language role models to include the culture and linguistical side of this thing. Thank you.
Broader than just the medical specialties that we normally address. So thank you very much for pointing that out. We've taken notes and all the things that the panelists are sharing, and further, of course, will be taken into consideration with the documentation that will move forward. So without much ado, we'll go to the next speaker, which is Carol Whelans, on behalf of the International Federation of Hard of Hearing People. And I ask all the panelists to please be conscious of the time so that we have time for questions at the end of the panel discussion as well. Thank you. So if we could pin Carol Whelans, that would be wonderful. Floor is yours, Carol.
Thank you, Diego. Friends and colleagues, the International Federation of Hard of Hearing People represents the interests of the 430 million people around the world with disabling hearing loss. Since the adoption of the WHA resolution in 2017, there has been some movement towards solutions, but in many ways, the struggles remain the same. The issues outlined in the preamble in 2017 remain much the same. In fact, the speakers ahead of me have made it clear that hearing loss continues to be on the rise. What should a new WHA resolution include? I suggest some meaningful additions to the existing paragraphs where member states are urged to act. Action item 3 recommended the establishment of suitable training programs for the development of human resources in the field of ear and hearing care. These training programs must include foundational education and training, as well as continuing professional development regarding new hearing-related technology. It could be hearing aids, assistive listening technology, and particularly cochlear implants. The need for training is particularly acute around cochlear implants, where people who would benefit from them are not getting the referrals because of a lack of knowledge by persons involved in ear and hearing care. On action item 6, the wording of the 2017 resolution stated that access to assistive hearing technologies and products should be improved, taking into account the delivery capacity of healthcare systems. It is crucial that international support be found to improve this delivery capacity in low-income countries, such as in the Asia-Pacific region and in Africa. With respect to action item 7, which recommended regulations for the control of noise, the International Federation of Hard of Hearing People is asking member states to ensure that these regulations are developed in a way that is meaningfully inclusive of hard of hearing advocates in their country. On action item 8, which spoke of improving access to alternative methods of communication, it would be wise to develop a solid understanding of the use of artificial intelligence to ensure high quality captioning. And even more importantly, artificial intelligence can serve as a larger world population. For example, it can be applied to more languages, particularly languages with a smaller number of speakers who do not currently have any real access to captioning. Finally, on action item 9, which is about working towards the attainment of Sustainable Development Goal 3, which is promoting well-being for all, the International Federation of Hard of Hearing People is currently developing a virtual global community network to facilitate peer mentoring between organizations of hard of hearing people around the world. Member states should support the participation of national advocacy groups of hard of hearing people from their country so that the world can be talking to each other and helping each other. Thank you for listening.
Thank you very much, Carol. Those absolutely wonderful points and being strict as well and very, very practical and focused. So very much appreciated. Thank you. Our next speaker is Dr. Rachel Hapunda, who will be talking to us from Zambia. Rachel, please go ahead.
Thank you very much, Diego. Ladies and gentlemen, today I have the honor of speaking on behalf of the International Federation of Otolaryngological Societies, IFOS, and the Zambian Ear, Nose and Throat Society, ZENTES. As we are gathered here, it's imperative to acknowledge the challenges facing ear and hearing care in Africa and other similar regions of the world, particularly the limited human resources available to address these pressing issues. According to the World Report on Hearing, there's an alarming shortage of ear surgeons in Africa, with some countries having as few as one ENT specialist per million people. This scarcity of trained professionals poses a significant burden, especially when compounded by competing health conditions and the high prevalence of ear and hearing disorders across the continent. Addressing this scarcity of human resources is paramount in our efforts to improve ear and hearing care in Africa. By investing in regional training initiatives and capacity building programs, we can begin to tackle this challenge head on. IFOS has long been committed to building capacity across East, Central, and Southern Africa. The Society supports the annual temporal bone dissection course held in Harare, where ENT surgeons from the region, along with experts in ear surgery, receive intensive ear surgery training. Additionally, there are efforts to establish more comprehensive training programs in collaboration with local universities and international partners, which not only focus on surgical skills, but also emphasize the importance of early detection and preventive care. Regional training programs offer equal opportunities for countries to learn from top-notch instructors and cutting-edge techniques, regardless of their individual resources. By pooling resources and services at a regional level, we create a more equitable environment for development, fostering cooperation and solidarity among neighboring countries. Moreover, these initiatives serve as catalysts for innovation and collaboration, enabling networking, knowledge exchange, and research collaboration across the world. Events like the World Course on Hearing Rehabilitation in 2022 in Harare showcased the importance of global cooperation in addressing the burden of hearing loss and highlighted the strides and challenges faced in different countries. Furthermore, these gatherings serve as platforms for sharing best practices and advancing technological innovations that can be adapted to local contexts. In conclusion, supporting regional training for ear surgery is not of care, which should be highlighted in a new resolution. By emphasizing the need for continued support and funding for these programs, we can ensure sustainable progress and better health outcomes for future generations. Let us seize this opportunity to pave the way for a healthier, more equitable future for all through collaborative efforts in ear and hearing care. Thank you for your attention.
Thank you very much, Rachel, and appreciate it of all the efforts of joining from the field on the scarcity of power due to the drought that they are suffering there. So I'm glad that you had power to connect. Thank you very much. Now we're going to ISA, the International Society of Audiology, who are going to have special dual role because of their initiation on the previous World Health Assembly resolution of 2017. So first we're going to hear from Professor George Tabarkiladze. George, the floor is yours.
Thank you very much, Diego. On behalf of International Society of Audiology, the international organization representing the views of thousands of audiologists across the world, who are greatly encouraged by the attention given by World Health Organization and its member states towards the issue of hearing, we fully support the request of the Slovak Republic, supported by Republic of Philippines, to initiate the process leading to a new WHA resolution on ear and hearing care, which will stimulate changes in the current status of care globally and particularly in low and middle ear income countries. The last and existing WHA resolution on prevention of deafness and hearing loss was adopted by WHO member states in 2017 and was preceded by the side event organized by IFOS and ISA during the 68th WHA in 2015. In 2016, during the 139th WHO Executive Board session, ISA actively supported the development and adoption of a new resolution. Despite that outstanding resolution, 7 years later, there is still serious work to be done, which requires the joint efforts of WHO member states and civil society to address the inclusion of hearing care within national strategies to achieve universal health coverage. This is confirmed by the WHO's global estimation on hearing care and its call to action published in the World Report of Hearing. During last years, the International Society of Audiology was developed programs and training modules to train audiologists and specialists working in the field of hearing and hearing care in low and middle income countries, and above all, in early detection of hearing loss in high-risk population, including newborns, infants, children, aging population, and people exposed to noise in occupational and recreational settings. They strongly feel that the new resolution will be a turning point for the millions who live with hearing loss, especially those who are in low resource settings and are commonly unable to access the services they need. In such situations, people with unaddressed hearing loss often spend their lives in social isolation and are unable to gain education or acquired livelihood. On behalf of all our members, I would like to strongly endorse the new resolution and offer our complete support in its development and implementation once it has been supported by the World Health Assembly. Thank you.
Thank you very much, George. And exactly what you mentioned about hearing back from the field is that we have Dr. Jackie Clark, who's been coordinating with Dr. Patricia Castellanos from Guatemala, who unfortunately could not join, but Jackie has been very kind to step in at a very short notice. Jackie, the floor is yours.
Thank you. I send my regrets from my colleague, Dr. Patti Castellanos. And from the perspective of the field of audiology and speech language therapy, there are really three main recommendations for the group to consider. The first recommendation is to establish suitable training programs for the development of human resources in the field of ear and hearing care. For this, it's important to identify national service and training gaps, facilitate enrollment of trainees, create positions to sustainably incorporate new ear and hearing care cadres into the labor market. The program should be offered at different levels to enable a formation of technicians in various areas, such as baccalaureate or undergraduate studies, which eventually could be the basis for graduate studies. One very important issue is that all courses must be supported by local universities. Among the different skills to be developed could include calibration of audiological and medical equipment, neonatal and school hearing screenings, repair and maintenance of hearing aids and audiological equipment. And the second recommendation is develop and implement monitor screening programs for early identification of diseases. So training of technicians for screening of neonates, school children and adults really is essential. It is important for us to get to that point and include ear and hearing care in the curriculum of primary healthcare professionals, as well as school teachers. It is important to establish, implement, and strengthen a referral protocol to ease access for timely diagnoses and treatment of ear and hearing problems. Additionally, it's necessary to establish a standard regulation and design the process for implementation of both neonatal and school age screening. It's important to have a comprehensive data collection system to allow access for analyses, studies, creation of national statistics, and ultimately that will aid in any decision-making by our government regulators. Lastly, third, improve access to affordable, cost-effective, and high-quality assistive hearing devices. Skills for fitting and follow-up services to be readily available in rural settings, as well as urban communities. Follow-up services really are needed for repair services, availability for spare parts, ear mold manufacturers, and so on. Promoting networks is also very critical by establishing a reference and counter-reference system that will increase sustainability outreach for all of the services that are there. Lastly, and also as important, is strengthen the public and private partnerships for the manufacturing, procurement, field adaptation, and follow-up for accessible hearing devices. Thank you so much for your patience.
Thank you very much, and thank you for rising so early just to deliver the message in the East Coast there, West Coast, or West mid of Dallas, sorry. We're gonna change slightly the order to continue with our line panelists. So our next speaker, thanks to the venue of Jacqueline Drexler, is Ann Porter, who is gonna speak as on behalf of the Global Coalition of Parents of Children who are deaf or hard of hearing. So Ann, please go ahead.
Thanks for the opportunity to speak on behalf of the Global Coalition of Parents of Children who are deaf or hard of hearing, which is known as GPOD. So we represent families from 17 countries whose children have been identified with permanent hearing loss. And while we fully endorse the importance of preventing hearing loss and the integration of ear and hearing care into universal healthcare coverage, I just want to focus on the challenges many of our members continue to face today. So children with congenital hearing loss, or those who acquire hearing loss at a young age, are some of the most vulnerable individuals when it comes to ear and hearing care. And in low and middle income countries, the support for families raising deaf children really remains inadequate. From the perspective of GPOD, several key priorities should be addressed in a new WHA resolution on ear and hearing care. First, universal newborn hearing screening is needed to identify children with significant hearing loss as early as possible. Hearing screening, however, is only the start of the journey for families with deaf or hard of hearing children. An integrated pathway of equitable and affordable services and support developed in consultation with families is crucial if the promise of newborn hearing screening is to be realised. It is essential to provide family-centred services and supports that recognise the central role of families in a child's development. Services should build on the family's existing strengths, support parental self-efficacy, and provide or mobilise the necessary resources for building the family's capacity to successfully raise a deaf child. We need to shift the focus of early identification of hearing loss from providing devices to early language acquisition. Most babies born today with hearing loss in LMICs are unlikely to have access to timely and high-quality listening devices that support functional spoken language development. Educating families, providers, and policymakers about the real and serious consequences of language deprivation on the child's future development and learning is really critical. For babies with hearing loss, early visual or sound communication creates a foundation for future language development, either spoken or signed, particularly when listening devices are unavailable or their provision is too delayed to optimize spoken language development. Children with hearing loss deserve access to multiple communication options from the outset in order to develop the complex language needed for literacy and educational success. And of course, hearing aids and cochlear implants are highly desirable for the acquisition of spoken language. But children still continue to need early intervention and habilitation to achieve age-appropriate language. In addition, lifelong and affordable services are required, including maintenance and repairs and access to accessories for ongoing use of their listening devices in education, work, and home. And as we have heard, to provide the services and supports that families need, we must urgently focus on building the capacity and competence of the workforce, not only health personnel, but also early childhood intervention providers, speech and language pathologists, teachers of the deaf, and sign language instructors for children and their families. And consistent monitoring and evaluation of services and programs is also necessary to ensure their ongoing efficacy and integrity. And finally, systems and services need to be designed to meet the needs of the people they are supporting. So consultation with families should be a minimum requirement when developing and implementing programs that support deaf children and their families. Thank you for your attention.
Thank you very much, Anne, and likewise, thank you for staying very late in Australia to be able to join and deliver the important message. So we heard from member states, we heard from professional organizations, we heard from persons living with hearing disability. We've heard also how, from not only from the professionals' point on the field, but the families. What about international networks? And our last but not least speaker, who's coming here in person, it actually represents one of the products already obtained from the previous resolution, which is the World Hearing Forum. And as such, Dr. Jacqueline Drexler is going to speak to us on the World Hearing Forum and the Changemakers workstream.
Thank you, Diego, and thank you for the opportunity to be here with you today. So as I sit here, I actually wear a few different hats in terms of representation. The first hat I wear is that I am an individual with hearing loss. I was diagnosed at the age of 2 years, and shortly afterwards, I was fitted with hearing devices and enrolled into speech therapy. So today, I wear a cochlear implant in my right ear and a hearing aid in my left ear. The second hat I wear is that I'm a doctor in audiology. Throughout my life, I've had a strong network of supporters and allies, enabling me to have options and opportunities for my future. This was so critical to have allies in my corner because I certainly came across those who questioned my abilities, who tried to hold me back. And I think this was because there was lack of understanding and awareness when it came to hearing loss. So this motivated me to pursue a career in audiology so that I can help enable others like others have enabled me. The third hat I wear is that I'm a program manager for Hear the World Foundation, a nonprofit organization. We partner with local organizations on ear and hearing care in low to middle income countries, providing them with resources such as hearing technology, audiological equipment, and capacity building so that they can continue to improve access in ear and hearing care in their local regions. The fourth hat is that I'm a member of the World Hearing Forum, specifically the Changemakers workstream. The World Hearing Forum is a global network focusing on advocacy and collaboration across ear and hearing care, with the goal that no person should experience hearing loss due to preventable causes, and that those with hearing loss can reach their full potential with early identification and appropriate management of their condition. Under the World Hearing Forum, there are several work streams, including the Changemakers workstream. With the Changemakers, we are highlighting and celebrating the stories of those with hearing loss and allies of those in ear and hearing care. Some examples of supporters are Malala Yousafzai, who is a cochlear implant user actually, and she is an advocate for education and girls' equality. Other supporters are musicians such as Brian Adams and Ricky Cage, who are advocating for safe listening to preserve music enjoyment. We also have Casper Bergman, sorry to put you on the spot, but he is a change maker as the vice president of the World Federation of the Deaf, advocating for human rights for people who are deaf. These changemaker stories are so important to our advocacy work because they help to build a movement to persuade government and societies to make hearing healthcare a public health priority. As we are here discussing the resolution, on behalf of the World Hearing Forum, I'd like to bring 2 recommendations. The first recommendation is to include people with hearing loss in the resolution as agents of change. Hearing loss is a part of our lives, and we should have a direct voice to illustrate that hearing loss does not have to be a barrier when you have the appropriate resources in place. Take this meeting setup as an example. So we have the inclusion of closed captioning and sign language interpretation. Even though this was triggered by the needs of those with hearing loss, closed captioning actually can benefit everybody in this room as well as online. I'm looking at all of you today who've probably been in a full day of meetings, listening, and discussion. I'm sure is quite tiring. But when you have closed captioning, it just helps to ease the listening effort a little bit while you can remain engaged. The second recommendation I would like to make is to have the World Hearing Forum included, as we are a global network of professionals across the ear and hearing care with valuable voices that can contribute. So just to summarize the two recommendations, the first one is to include those with hearing loss as agents of change, and to include the World Hearing Forum as a global network to encourage further advocacy on ear and hearing care. Thank you so much for your time.
Thank you very much. That's a wonderful wrapping up of all the things we heard today. Agents of change. Now, everyone likes change, or at least the concept of change, until we, and I include myself in the group, we're asked to change. But society doesn't change unless we start changing ourselves. So that's what's missing from you and me, starting to be an agent of change for ear and hearing care. So dropping some thoughts. We've got a few minutes left, not as many as we would like to, but we would like to open the floor for any questions or any comments that you'd like, either from the audience here in Geneva or from our participants online. So I'm going to pass the floor to, yeah, you see any questions here in the room? Yeah, or then, okay. There's a question there.
We have a question online, which is addressed to Shelley. The question is, agree that integration across life course and continuum is the key to EHC, but this is lacking in low and middle income countries. What initial step would you advise to these countries to begin with?
Yeah, thank you. Thank you for the question. So I think the initial step would remain the same irrespective of the income status of the country. And that is to take stock of the current situation. So what is happening currently, what is happening on the ground, but also look beyond just the ear and hearing care field to look at who are the partners out there, what other programs exist in the ministry. So to do really first a stock take, a situation assessment, and then also to start planning along with all the stakeholders that you have identified in the process of this stock take. WHO also has certain technical resources to help facilitate that, but that's just on the side. But I think the first step for any situation remains taking stock and then having multi-stakeholder engagement to discuss how we can move this forward together as an integrated agenda.
Thank you very much. Yeah.
Thank you. There's one more question online to Kasper Bergman. Hearing is a key capacity for healthy aging. Does the WHFD have information concerning healthy aging in people who are deaf?
Not specifically, I have to admit, we have not had specific attention to that area. I know there's a large group of elderly deaf people across the world, but it hasn't been an issue for us, especially until now. What we know is there is a huge stigma attached to hearing loss, and of course we hope to help eradicate that stigma, including for elderly people that should not be ashamed to need, for instance, hearing aid or other assistive technology to have a good quality of life in that part of their life as well.
Thank you. Thank you very much. Yeah, there's some.
Yeah, there's just one more comment actually in addition to the emphasis on children and noises exposure, we really need to have a fresh focus on hearing in healthy aging, especially in the integrated person-centered care in primary care in line with WHO ICO. Just to underline the other questions on aging.
Yep. Any other questions from the ground? Yes, a question here. Yes, and so we got two more questions here. Please.
Hello, thank you very much. Sarah Collinson from Sight Savers and co-chair of the Inclusive Health Task Group at the International Disability and Development Consortium. I just had a comment really, which partly comes from that sort of professional affiliation, but also from my personal experience, because I have one of my children was born very profoundly deaf and actually couldn't really fully benefit from hearing aids, even though we live in a rich country where he would have had access to technology if he could have benefited from it. I just wanted to endorse Casper's point about the importance of a really holistic approach to ear and hearing care, particularly if there will be a new resolution, and really from a parent's perspective, thinking about all the other rights associated with my son's right to health, his right to education, his right to live an independent life in the community, all the associated rights that we know are integral to the right to health. Just want to sort of put out a plea that broad interpretation of the right to health and all the associated human rights that can be quite difficult to achieve, particularly in low-income countries for children, particularly, I suppose, children, but everybody who has a hearing loss, and that includes obviously access to technology. Thank you.
Thank you very much. Wonderful point. Yeah. There's one more question from the floor. Comment or two more? Yeah.
Yeah.
And then
my name is Peter Wiesner. I work for Action Against AIDS Germany. I was really impressed by some of your stories. And why was I impressed? Because hearing loss is always sort of combined with, with a loss and with something that is bad that should be changed. And when I look at Casper and especially at you, what you told me, or what I understood is that hearing loss can be a source, something positive, and you can change it into something positive. So my question to you is there a strategy on how to change the perception of hearing loss, which goes in line, at least to me, with the negativity that is aligned with it and with the stigma that's aligned with it? So is there a strategy? And if there is, what is the strategy? Thank you.
Yes, that's a huge question, very difficult to answer in a short time. But to start with, it's about changing people's view of deaf people and deafness as a thing, not something to be pitied or something to be aided, to change it to see deaf people as citizens with something to contribute to society, like we all are, and just to give them the chance to give that to the society that they can, and just to aid their language acquisition and their access to education, lower level education as well, and give them the chance to contribute to the society with the respect that you would owe anyone who contributes to their society. But there are so many places to start. Awareness raising is one, early access to sign language, early identification of deafness, the changing of the view of sign language, changing the view of people with a hearing loss, and like eradication of the stigma. There are so many places to start. And I think we can get a long way in that if we work together and we try to integrate deaf people in the society as well as we can.
Yeah, and I would just like to add to that. And that's why one of the reasons we are highlighting the stories of the change makers, to really show that hearing loss does not have to be a barrier. So we can achieve what we want to put our minds to, providing that we can have access to the right appropriate treatment and access to care. And for me, I like to say that if someone gave me, could grant me a wish, and if that would be to change my hearing to normal hearing, would I like to take that? And actually, I wouldn't. For me, having hearing loss is part of my identity. It makes me who I am today. I'm not ashamed to it, and it doesn't stop me. And I think highlighting that it doesn't have to hold us back. And that's where we can continue to work towards removing some of that stigma, because I think there's actually quite a lot of benefits to having hearing loss, but that's just because that's how I managed to overcome my obstacles. So thank you.
That's wonderful. And then we're conscious of time, so we're going to leave the last words to Professor Subada from the Permanent Mission Slovakia, please.
Thank you very much. I hope that it will be not the last set of the words, but I would like to congratulate to all the speakers and contributors. It's wonderful to be here and to hear your really testimony for all of us. But what I would like to ask is also something very simple. Sometimes to convince also politicians and policymakers to really advocate and to accept that this is integral part of the services, as it was mentioned in a couple of interventions. We need some data, and we know that we are really lacking this behind, and we have different registries at the universities and different hospitals, but we are not able to benchmark them because they are not united. Do you have some ideas how we can perhaps unified this also in the way to advocate more effectively for the social determinants of health, cultural determinants and others, because it's not only a matter of the healthcare settings and health ministries, but also it is silo related issue across all the stakeholders. Thank you.
That's a wonderful question, which we could have another side event just on that. The beauty is that WHO has produced with a lot of technical teams advising a lot of the tools to be able to gather that data. And we are all together, we're actually trying to encourage not only governments, but academic institutions, partners in the field to use those tools, because many of them still use their own resources. But that's no way to have a homogeneous and comparable data. So there's a very, very relevant data. We are on the way, but we're still, like many of you have already said, 7 years later, we're still a lot of work pending to be done. But maybe, I don't know, maybe Alarcos or Shelley, you want to add something to that? Or thank you so much, Shelley.
We are only just getting started, and I think only just starting to hit the tip of the iceberg. There is a lot more to be done. And data, of course, is a key part of the work that we need to do moving forward. But I think even for countries to focus on getting that data, they need to first recognize the relevance and importance of addressing or of hearing loss as a public health entity itself. Thank you.
Thank you so much. And with that wonderful comment, I'm just going to leave the word to Professor Milan Profan, who on another hat, he wears many hats as well. This case on the hat of IFOS is going to give the closing remarks. Now, before he does so, just for any one of you who've got contacts or with any member state delegations here in Geneva, tomorrow on the agenda, in item 11.2 of the agenda, give you the full name, the follow-up on the political declaration for the third high-level meeting of the General Assembly on the Prevention and Control of Non-Communicable Diseases. That's when the Slovak Republic is going to make the statement, and many other countries are going to support as well, and non-state actors like CBM will be able to endorse that as well. So if you have any contacts, we're still in time, still a long night until tomorrow. So with those words, I'll pass on the closing remarks to Prof. Milan. Thank you very much.
First of all, I would like to thank Diego and his team for organizing this side event, and also for the WHO non-communicable diseases department to support us. And I am very much impressed how many institutions, non-governmental organization, patients, not patients, people with hearing loss, are touched by this problem. Really, it's a very serious thing which is expecting us to increase on the next period of time, and we have to do something. I recognize with those beautiful contributions in the panel discussion 3 terms: support, awareness, and education. And these all 3 things perfectly fit what Shelley was mentioning, integration. And this is something what we have to keep in our mind for the next future. And definitely IFOS and other expert organizations in this field will support this term. Thank you very much once again for coming here.
Thank you so much. Thank you for everything. Thank you all. So with this, we conclude. So we'll close here. We'll follow up on all your questions, all your comments. So stay posted and we'll be approaching you at some stage. So with this, we close. Thank you, everyone. Have a very nice day. Thank you.